Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi guys, welcome back. Hopefully you enjoyed our episode last week. And today we're going to be talking to Keslie Redel. She is an autism specialist, also a licensed clinical professional counselor and an art therapist who is board certified. And she owns her own practice. And so she does outpatient mental health counseling. And she also previously provided counseling to dually diagnosed kids in a residential treatment facility for 7 years. So she has a ton of experience on autism, which is our topic today. We are going to be breaking down what autism is and how to know if your kid might have autism, what you should be thinking about or questioning about your child if you think they might be on the autism spectrum. So with that, let's get to Keslie.
Hi, thanks for having me.
Yes, I'm so excited about this conversation that we're going to be having about autism today because it is an evolving area. Since I went to school, right? And that was a long time ago, but we have learned so much more about what autism is. And so I'm excited for this conversation for not only myself, but for also the people generally and also parents of kids with autism. So welcome. We're so glad you're here.
Thank you. Thanks for having me.
Yeah, absolutely. Okay, so let's talk with briefly describing what do we mean when people say neurodiversity? What does that mean?
Sure. So neurodiversity, it depends on your school of thought with this. So to kind of boil it down in general terms, neurodiversity refers to the way that our minds operate differently. So that could look like, different types of diagnoses. It could, be really referring to the way that we process information could be different. So it's really just kind of an umbrella term to speak to how differently our brains operate compared to each other.
Yeah. Well, and I think it used to be that neurodiversity was only about people with autism. I think that's kind of what the term was referencing. But as we've evolved in this term, right, we have incorporated a lot of different diagnoses into this term, right? Yeah. Okay, cool. Yeah. So let's get into the heart of this of what is autism? And sometimes we say ASD, autism spectrum disorder. And let's talk about signs and symptoms. So early versus elementary. So there's a lot. So let's start with what is autism? What does this diagnosis mean?
Yeah. So I'm glad you said it is a lot because it is, and it looks so different for every single person. So, speaking to kind of how autism is diagnosed, as far as our diagnostic manual goes, it really refers to some set characteristics that might be seen in kids or adults. So, a lot of those things have to do with repetitive patterns of behavior, some rigidity in how we follow routines and how we want to do things. It could be some sensory issues, some social issues, as well as some communication types of things as well. So those are kind of the general things. And, these things vary over the lifespan, like you mentioned, with, the really toddler type of kids versus elementary school, high school, so on. And it is a spectrum because even if, we have a toddler diagnosed with autism and we're seeing these sorts of things, those things can change over time. So it's not even things are set in stone or the skill we're seeing isn't developed right now because, it could just be delayed, which is in essence what autism is developmental delays, type of disorder is what it's labeled.
Got it. Yeah. So it can look so different. It's kind of in our ADHD episode with Todd Johnson, we talked about how if you know one person with ADHD, you just know one person with ADHD. It's such a spectrum with that too of it varies from person to person. And so I think it's important that we name that it is such a variety, right? There's some fundamental pieces that we're looking for. So an issue with communicating, an issue typically with sensory. I see that a lot too in repetitive behaviors. It can be hard for them to pick up on social norms, and understand how to work with other people. So I think and also that rigidity piece is really important too, of like, there is a lot of difficulty with flexibility. So like, these are like the foundational pieces that we're looking for, but what it presents like in each child is so different. Yeah. So what are we looking for? So like, can you tell me some symptoms for the parents out there who are listening? Like if we had a toddler with autism, what kind of things are we seeing, or what kind of things are delayed that you might notice that might make you say, this is maybe not typical?
Sure. Yeah. So I would say with toddlers specifically, there might be a regression of skills that were previously learned up to that point or mastered. So, for example, using a spoon or using hands to eat, something like that, we could see a little bit of a regression with that, or even methods of communication that might be pointing or kind of approximating some speech with mom or dad or dog or whatever. We could see some regression with that. We might also see those little social things as far as how we interact with toddlers of, playing peekaboo or playing let's go find this toy or something like that. We can really see a lot of, what might look like lack of interest or lack of engagement, lack of eye contact maybe. And, we can see some things too as far as repetitive behaviors go. So we, kind of the classic one that a lot of people are aware of is like hand flapping. We might see some things where we're turning our hands a certain way over and over again. There's a lot of kind of physical behavioral type of things we might see along those lines. And we might see some sensory issues start coming up at that point too. And that, that could look like not being comfortable in certain fabrics, or we don't like socks on, or we don't like shoes on, things like that. And, I want to mention too, that a lot of these things can be really common to see in toddlers. So we don't want to immediately jump to, oh my gosh, my kid has autism. But I would say that, at that age, if there's several of these things happening at one time that kind of raises some questions for you, I would say do not hesitate to ask your pediatrician about that, or ask someone at the preschool about that, things like that, because that's really going to help point you in the right direction as far as, okay, should I be worried about these things? Like, where's my bearing at here? So, I would caution people from jumping immediately into a diagnosis. However, I would say too that if you're having a gut instinct about something, like trust that as much as you can and ask questions as much as you can. Because I think, that clears up a lot of anxiety for parents.
Yeah. Well, and there's more things that we can get into the meat of it, right? So like you have these specific behaviors as a parent that you're concerned about, and then you present them to somebody who's qualified to diagnose that, or to say like, yes, we need more data here. Then they can assure you that like, this is normal toddler development, or, hey, yeah, like let's look into this. Let's put some more time and attention to this to see if this might be something more specific like autism, or it could be just a sensory issue, right? Like we can have that sensory issue and not have autism, because although they may be combined, you can also have ADHD, or you could just have a sensory issue. Like there's so many different ways that this can present. So we need an expert to really look at it to say, kind of what their formulation is, and to look more specifically into it. So those early symptoms, tell me about like early childhood. So like we're thinking elementary school here. What are we seeing with those kids that would be hallmarks, or just things that we're looking for in terms of their behavior?
Sure. So obviously with school starting, we might see some academic learning challenges come up, depending on the child, obviously. Some of those things might look like the kiddo has a hard time sitting in their seat, or they need to get up and have bursts of energy from time to time. And we also see a lot of these social things come out at that point, because, there's more kids, there's more demand in school. And oftentimes when those demands are looking different and they're coming from someone other than the parent, that's where we might see a lot of, maybe avoidance or frustration or confusion, which can lead to some of those behavioral things that can be challenging, not only for the kid, but for, their teams and caregivers to understand. So that, and, as far as looking at kind of like play milestones, we might see kids that don't really engage with other kids, or we might see kids that like to play, but totally on their own. They don't want they don't want anyone playing with them, or they want to play a very particular way that doesn't necessarily gel with what the other kids are doing. So, a lot of those social and learning pieces of things we might start seeing there.
Yeah. Well, and so that's a good part. So like as play therapists, we're looking for kids when they're little and they're like infants. We look for like individual play. They're kind of like doing their own thing by themselves. And then we do this thing called parallel play, where we're like playing in the same space, but we're not like really playing together. So we might both be doing blocks, but we're not actually like engaging each other. We're just like doing our own blocks, but next to each other. And so like that's a healthy next step, right? And then by the time we get to elementary school, we really want kids to be doing collaborative or cooperative play where they're playing together. So instead of building each of us a tower ourselves, we're building them together. And sometimes that's what can be also a real struggle, is like, I want to stay in the parallel play, or I want to be very rigid about how I am doing cooperative play. Like, you can play with me if you play like this, but if you don't play like this, I'd rather you not be here. And they can sometimes be a little bit, rough about how they present that. Whereas like a kid who might be more neurotypical might say something like, I really would like to just play like this by myself. And a kid that maybe is autism, and obviously every kid is different, but they might say like, I don't want you to play. Right? They might shoo you off to playing, or not be open to any other ideas besides their own. So something to be looking for as parents is like, we're looking for just like typical developmental milestones in terms of play. But that's an important one, because play is our language, right? Like so much of what we're doing in early childhood is playing through these things or scenarios that we've been through. So it's important that play is a part that we're observing.
Yeah.
Okay. Is there anything else you want to say about like things that we can be looking for in that early childhood?
I think we pretty much covered. The only other thing I thought of was the piece about transitions, which we see a lot more of when kids start going to school, is transitioning between class to specials, or from class to the lunchroom, or whatever. And those transitions can be really, really stressful for kids on the spectrum. And, stressful in general, I would say, for any new kiddo in school, but especially stressful and challenging for kids on the spectrum sometimes.
Yeah, those transition, because it's like there's a lot of prep that they need a lot of times to transition. And if that supportive environment is not there, then that can be hard to transition. And it's like you adjust this one thing, and then it's like already time to move to something else. And it may not be that you notice that kindergarten is hard with transitions, because I find that a lot of kindergarten teachers do a lot of support with that. But then as we get older in the grades, the expectations in our behavior are more. And so then they might struggle with those transitions, or you notice at home that the transitions are hard. It's like, okay, you're doing X, right? We're watching a show, and then it's time to eat dinner, and that might result in a total meltdown.
Yeah.
So, and something I want to go back to that we said, so the hand flapping are repetitive behaviors with our body. Why do kids do that? Like, when we think of a kid with autism, like, why are they doing that thing?
Sure. So yes, that's a great question. So this is kind of leading us into what's known as stimming, which is short for self-stimulating behavior. And that could be fulfill a sensory need. It could be driven by emotion. It can be driven by, this just feels really good. And I love seeing the different stims that a lot of my clients have had over the years, just because they're all so different. And they all serve a purpose, and it's not something that needs to be addressed or changed necessarily, unless obviously there's a safety concern. But that's a form of communication. All of these behaviors are a form of communication that doesn't necessarily need to be diminished or redirected unless there's a safety issue there. Like, let's try to learn from this kiddo and figure out, okay, so they're jumping up and down and spinning because they're really excited about lunch today. Or, something like that. And I know that can be challenging sometimes in classrooms when we're trying to manage all of these kids and maybe keep the energy level at a certain place. So it's kind of all about let's learn from this kiddo and figure out how we can make all of this happen together while we're still meeting these expectations that need to happen.
Yeah, it's about getting curious, which is something that I'm so interested in teaching parents and teachers and administrators, is about getting curious. Because if we understand the behavior, like if they're so excited, they're doing that because they're excited for lunch. We don't want to stop them from that necessarily. Right. Like that's a great expression, but helping them to evolve into something that is, not dangerous, but is also like helping other people, other kids in their classroom to understand where they're at. Like, oh, Bryce is so excited because she is going to have a great lunch. Her mom packed her this lunch and she's really excited about the animal crackers that are in there. Right. And so then that helps to normalize so that other kids are also not concerned. Right. So that the more that we're communicating and helping the other kids to understand too, the more it makes this kid approachable, which I really think is so important because we don't want to isolate them from the other kids.
Right. Yes. I will add too, obviously there's some self-stimulating behavior that is not something that is good for that child, like, finger picking or biting its skin around nails or, slapping the side of our leg, something like that. Obviously, if there's, like we mentioned, an element of safety there or something, we can still look at that with a curious lens to figure out, okay, like they might be anxious about something or they're trying to communicate something to us that they don't have words for yet, or they don't feel safe communicating yet. So yeah, I appreciate you mentioning the curiosity piece because I think there's so much to learn in these situations as opposed to us being corrective at all times.
And sometimes it is about replacing it, right? So like we figure out kind of what's going on as much as we can because I'm going to ask you a question about the spectrum in just a second, but there's such a variety of kids presenting. So some of them may be nonverbal. So that's maybe the only words that we have, right, is our behavior. But then there are kids who are verbal and able to articulate what they're thinking and feeling and what's going on in their mind. And so we can still help them to do something that's safe. So like having a different like sensory object sometimes will be a good replacement where they don't feel shut down, but it's a healthy way to get that stemming or that need met or that communication to be had. Right. Okay, so let's get to what is the spectrum, because a lot of times people say they're on the spectrum, and what does that really mean? Like, what is the spectrum? Why is it a spectrum? Help us understand.
Right. So the spectrum refers to, if we look at it diagnostically, there's 3 levels involved with diagnosing autism. So there's level 1, level 2, level 3. So what those do is try to kind of categorize the developmental delays, the needs, sometimes the strengths. I wish the strengths were focused on more sometimes. But, the process of diagnosing is really to help us figure out a good path of support for those kids. So, I hesitate to cling to the label, like I mentioned, but with the systems that we work within, those things are so important for us to get what we need and advocate in the way that we need to. The spectrum of autism can look so different depending on the person. I might have a kiddo who you are interacting with and, they might seem a little kooky and you would not, it would not immediately come to mind like, okay, this kiddo might be on the spectrum. But then you learn like, okay, they're struggling with this, and this, or there was a developmental delay a couple of years prior. So it can kind of look like that. And, there's also the very opposite end of the spectrum too, where we might have kids who still need help toileting or need help eating or need help, doing personal care tasks that, are typically basic fundamentals for us to function every day. So there are people that need more support and there are people that need less support. And it's kind of a grab bag, and I should mention too that, fitting autism within 3 categories is somewhat limiting because that's only 3 categories and there's so many different pieces to it. So, I guess the spectrum is kind of a confusing vast thing that just mentions like autism can look one way and can look totally different. And like you mentioned, like one person with autism is one person with autism. It's not going to be the same for every single person.
Yeah. Well, and I think also we're still evolving here, right? So like, 10 years from now, we may have 27 levels of autism, right? Like, I think we just don't know, right? And
Yeah.
maybe it's not levels, maybe it's different names. And we used to call high functioning autism Asperger's. And then we did away with that when we did the new labeling. I don't know that that was the right choice. However, I didn't get to decide that, right? So I think there is a lot being evolved in this part in medicine and psychology that we are still learning so much. And so keep in mind that this is evolving. So like 2 months from now, this may be obsolete information. I hope not. But I mean, also kind of am hoping that it is, right? Like, I hope that we grow and learn more in that. So, okay. So talk to us about, when are you able to start recognizing autism apart from a neurotypical kid?
Sure. So, I did some research before this just to see what the current research is saying. But, I was reading a few different articles that mention that somewhere between 18 and 24 months is kind of where we might see some of those hallmark, repetitive patterns or social things happening. So that, for the most part can be reliably diagnosed at that point. However, for some kids, and depending on different environmental factors or trauma or different things that might be happening at that age or throughout the lifespan, we might not be able to diagnose it until further into childhood or even adulthood. So it really can look so different. But typically, if you're kind of keep an eye out for some of these things, we're looking at between 18 and 24 months. And I will say too, that there has been some recent research indicating that kids diagnosed at that age, there's a small percentage of them that are reevaluated as they've gotten older and they no longer qualify for the diagnosis. So, there's, again, that's kind of part of that spectrum too, is, okay, a kid might be level 2 at one point, and then we reassess 5 or 10 years from them and they're down to a level 1 or a level 3, it just looks so different.
Yeah. Well, and I think it's important to notate that, like, you could have a kid that looks developing totally typically, then all of a sudden it seems like things shift. And I think a lot of times we've been looking for an explanation as to what happens to cause that. But I think as we have evolved, what we've found out is it's just part of how that diagnosis is presenting, right? So like, you may not know in other diagnoses that your kid has ADHD at age 1. They just look totally typical to every other 1-year-old you see. And then as they progress, right, typically in that early elementary school time, then it's presenting. But it didn't mean they didn't have it before. It's just that they looked very typical until they didn't. And so I think that's important to keep in mind too, is that piece. But I've certainly in my practice notice like adults that I'm like, oh, we might have autism, right? Like we might be on the spectrum here, and or a high schooler or a elementary school kid that's later in elementary school. And so there are definitely times where we might not have met those pieces earlier, and then we are meeting the criteria at that time. So good to keep in mind. So what do you think you do if you think your child has autism? So like, we're talking about these symptoms, this is going to resonate with some people of like, oh, like my kid has some quirks or some unique things about them that I just can't explain or make me go, like, or they have the hand flapping or rate some of these stereotypical behaviors. What do we do then? What do you recommend that parents do once that's been recognized?
Sure. So I have been asked similar questions by client parents. And the first question I usually ask them is, how would more information help you? Because sometimes, obviously we want to know, like, is this okay? Do we need to be looking into something else? But I do think too, there are times where, we get maybe overly curious, and we might see things there that are reminiscent of something else or remind us about this podcast we listened to or whatever, which could lead to some misdiagnosing. I wouldn't say that happens very often, but I would encourage them to think about, how would this information be helpful for me? What do I want to get out of this? How will this help my child, sort of thing? And then from there, if we really need to ask some more questions, reach out to your pediatrician, obviously. And I would mention too, even prior to that appointment, start keeping track of things. Because, sometimes we get into appointments and we might be asked a question and we're like, well, I know what's happening, but I'm not really sure how long it's been going on or what exactly that looks like. So, if you start noticing little things, like keep track of it. Keep track of maybe when you noticed it started, what it looks like for you. And then, when you do start having those conversations with the pediatrician, or if you have a mental health therapist that you're friends with or can refer you to somebody else, or the child's teacher, preschool staff, anyone that you can ask those questions to should be able to point you in the right direction. If they don't know the right direction, they know somebody who knows the right direction. So yeah, I would say put those feelers out and ask those questions. And I would encourage parents as well to follow your instinct with this. So if you truly feel like something is up and maybe you're not getting met with the response that you're looking for, like be that squeaky wheel and advocate for this so that you can make sure you're taking care of your child in the best way that you possibly can, and to ease any anxiety about the future. Because really, if we're able to notice these things early, that's really where growth can happen. So the sooner we have information, the sooner we can do something about it, and make sure we're raising a resilient, happy child.
Yeah. Yeah. I mean, because that's a great point of you, regardless of what, I think we all have complexities to us. Nobody, there's really no typical person existing, right? Like we just have these milestones that we're trying to base against other things so that we have things to look for. But, getting diagnosed for anything is sooner is always better. And then we get the resources put in place. And I think that's the thing. I'm with you on the diagnosing. Like autism is one that I would be more in favor of getting a diagnosis for, because we get resources within school. We can get resources within community. Our insurance can pay for things that we need. There's a lot of benefits to that. However, I think if there is no benefits, then maybe we look at, we already have the resources. Right. Is that really valuable to our kid? But also sometimes the diagnosis is freeing. I have had times where I have brought autism up to families, and you would think as a provider, you're like, oh gosh, I don't want to like upset them by saying, do you think your kid could have autism? Like, has this ever met your radar? But a lot of times when I do, it's almost like a light turns on. They're like, oh my gosh, yes, I have been researching this. And I am like, it's been a question on my mind. I'm so glad you brought it up, because I didn't want to like tell you what you should think about this. And so I think it's good for you to say what you think, right? Like, I think this could be autism, or I'm curious, or like, tell me what I need to know, or where are there places to get research. And we will provide some data points and different information that's important to help support this journey. But pediatricians are a great place to be. And sometimes we need testing, right? So, your pediatrician that you see for all other things may not actually be the person who diagnoses your kid with autism. So sometimes we need psychological testing a lot of times, right? There's different people that can diagnose that definitively so that your insurance will cover the resources that your kid could need, like speech therapy or occupational therapy or any type of outside services, and also allows the school to get resources to meet that need for your child. So there's a lot of different things that come into play, but also there's developmental pediatricians who do specialize in that and would diagnose your kid, even sometimes without the testing, because they are so specialized in that particular place. But sometimes therapy. Do you diagnose, Keslie, or you send out for testing? How do you do that?
I feel like I can spot it fairly easily. But yeah, I always refer out for testing, just because typically parents want that diagnosis to get accommodations on IEPs or accommodations in school, or, maybe even medications for an anxiety or co-occurring things happening. And I think that testing is really, really valuable. And can reveal more information that maybe parents didn't know about, or they can receive some recommendations, things like that.
Yeah, I think that's great. So, I mean, I can spot it too, but I don't have the autism certification like you do. And so I think I always refer out. So it's good for parents to know that testing is a critical part in this piece of getting that definitive diagnosis and getting things in place. Okay. So talk to me about what you want parents to take away from this conversation. We have just downloaded a ton of information. So what is the things that you really want them to focus on with this?
Sure. So it has been a lot of information. So I feel like what I want parents to take away from, our conversation today, as far as, recognizing signs or taking next steps, things like that, is is to consider what your response is going to be in the event that you have a kid on the spectrum. So, because I think that, for some people, I think the view might be, oh my gosh, this is going to be really hard. I'm having a hard time finding hope here. How am I going to manage this? How am I going to do this? And I guess the feedback I would offer in those situations is to say that, there's always going to be a hard, and you got sprinkled with the autism hard. It's not something necessarily to be fearful of or worry of, because you are going to be the strong advocate that your kid needs. So I think having faith in yourself and trusting yourself as far as, okay, I love my kid regardless of how this is going to turn out, and I'm going to push them and challenge them and advocate for them any way that I can. I think having that lens is going to be super, super helpful. And maybe putting aside some of our own anxieties or our own preconceived notions of what being autistic is, because it can be so different for your child, and a lot of it depends on your view of it.
Yeah, totally. And how our kids then interpret it and how they understand. Right, exactly. And it's such a cool thing. I mean, I have had the lovely opportunity to know lots of autistic people, whether they're kids or adults. And I mean, cool people, right? Like fantastic, living great lives. And I think sometimes that worry piece, like the anxiety piece of like, will we get through this? Yes, you will. You will get through this, even though it may be hard. We're all going to have hard things, right? And there's some things as a parent, I mean, I know in my own life, there's lots of things that I don't feel equipped for. And I literally do this for a living, right? So I have to get curious. I have to get educated. I have to ask my kid when that's possible, right? Like to support them. So this really isn't any different. It's just that there's a difference, right? That we can name to give us resources and also to help us understand. But again, every kid with autism is just one kid that with autism. So they're going to be different. And so that's the cool and complex part of this. Well, thank you so much, Keslie, for being with us today to introduce this idea of what to look for with autism. We're so glad that you were here.
Thank you.
Thank you so much, Keslie. That was all really great information. I hope that you enjoyed the information that she shared. And if it applies to your family, that you now have the resources to kind of go forward and get more information. So the takeaways from today for my side are these three things. I want parents to be curious, right, about what is going on with their kid. And also, second thing, advocate, right? Don't forget to be your child's biggest advocate, because you are the one who knows your child the best. And also you're the one who is going to make sure that they get their needs met. And the final thing is love your kid, right? No matter what their diagnosis, just love your kid. And some days that's really hard. Sometimes we have a hard time being able to love our kids with the behaviors that they're showing. Maybe we love them still, but it's hard to like them. But I would just encourage you to love on your kid. And with that, I will say, if you like what we're doing, please like and subscribe and share our episodes with your friends. Follow us on Facebook and Instagram and YouTube, and send us emails. If you have things that you think that we could cover or you're interested in certain topics, please send us an email to accidentalexperts@gmail.com. Thank you so much for your time today. Have a fabulous day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.